Hi, my name is Jesus Matos. I am a vascular surgeon with Peripheral Vascular Associates. I look forward to seeing you in my clinic so we both can prevent any further issues and help you with the current problems that you have. I was originally born in Mexico in Guadalajara. At the age of 10, I moved to the United States. I went to high school in McAllen, Texas, which is where I grew up. Eventually, I went to the University of Texas at Austin, where I did my undergraduate. Went to Indiana University, where I did my medical training as well as my general surgery training. At one point, I thought I was going to be a surgical oncologist, so I did 2 years of research that was funded by the National Institute of Health. And eventually I saw the light and decided to become a vascular surgeon. I did my vascular surgery fellowship at Baylor College of Medicine in Houston, and eventually I stayed there as faculty, and now I'm at Peripheral Vascular Associates. The main reason why I decided to be a vascular surgeon is because of the technology that is available to a vascular surgeon. Once again, from minimally invasive technology to major surgical vascular bypasses. It also allows me, is one of the only fields of medicine which allows me to have these patients for a long time. Usually vascular patients develop more issues along the years, and I can actually keep a patient for their lifetime of my practice. And that is very important to me, to try to develop these relationships with these patients. I am also bilingual, and I'm very fortunate to have a wonderful family with my wife Joanna and 2 daughters. Some of the minimally invasive procedures that we can offer can range from venous procedures to arterial procedures, as far as trying to fix somebody's aneurysm, minimally invasive. So from a vein standpoint, if a patient has a venous wound, we can provide an ablation, we can provide injections, and those can take 20 minutes and the patient goes home the same day with just a small puncture site in their leg. If they require some major revascularization or opening of the blockages of their arteries to help them heal wounds or prevent gangrene, those can take up to 45 minutes, and it's the same principle, which is with one little poke into the artery percutaneously, we can fix those issues and the patient will also go home the same day. The biggest thing that we can provide minimally invasive is as far as fixing an aneurysm, an aortic aneurysm repair, which traditionally, before this technology was available, required a 4-hour operation and the patient needed to stay in the hospital for as long as a week in the intensive care unit. Nowadays, we can do it with 2 small puncture sites in the groins and the patient goes home the next day. This kind of procedures can take as short as an hour and a half. So it has really revolutionized the field of vascular surgery. One of the great advantages of working at Peripheral Vascular Associates for me, I used to work at the medical center in Houston at Baylor College of Medicine. And working here, the huge advantage is that we can actually provide everything for the patient the first day that the patient comes to meet the doctor. So from the time they walk in, they can have their pre-testing, so they get their ultrasound, then they will see a physician. The physician will make a plan. In some cases, if the patient needs to have one of those minimally invasive procedures done the same day, we can accommodate the majority of our patients to have those done the same day. So in other words, in one full morning, we can go from diagnosing, plan, and treating the patient, and they will go home with hopefully a resolution of their problem. I think as a vascular surgeon, the patient relationship is very crucial. Number one, because a lot of the patients that I see, I am trying to change their habits or make them or allow them to understand that, you know, some of the risk factors that they're having actually are long-term consequences of the diabetes, the smoking. So for me, I specifically spend a lot of time the first time we meet each other and on subsequent visits to try to make them understand that in order for me to help them, they have to be compliant with some of the treatment options that I am providing them. Also, at the same time, since some of these patients will require eventually several visits and several different issues will come along, the closer that we become in that relationship, the better it will be and the better outcomes the patient will have if they can develop that trust with me from the beginning.